Welcome to another broadcast from mindyourhealthcast.com. I know you were anxiously awaiting to see what pearls of wisdom I was going to lie on your dressing table so that you could adorn yourself with more and more wisdom to deal with this world. At any rate, I am happy to be back again, and I have brought to you some interesting presuppositions for you to chew on, and maybe you can swallow, maybe you can't. But at any rate, we want to be provocative and challenge your thinking just a little bit. So what I'm going to be talking about are perceptions, perspectives, and choice. It's interesting how it came about that I even considered that, is that occasionally I do watch some television. I don't have a tremendous amount of time to watch it, but when I do, more often than not, I'm watching history or one of the channels that have a lot of information. Sometimes biased a good bit, sometimes not so much, but seemingly over the years I feel that they've gotten better at presenting more factual things than deliberately trying to debunk some point of view. But at any rate, I catch some of the commercials for the various drugs that are put on TV, and It intrigues me because being in the health field, I meet all these people coming in, many taking anywhere from 3 to 5 up to as high as 25 prescription medications on a daily or bi-daily basis. And it makes me wonder what's going on in their thinking process, that they would allow themselves to be presented with so many different medications. But then, as I got to thinking about it, it was interesting to note how they view the ads. And of course, that's the big seller. And I've mentioned before, the U.S. happens to be the only country, as far as I know, that allows direct to the consumer advertising of legend or prescription drugs. So at any rate, they pour out all this information. They spend millions of dollars doing it. So when they spend millions doing it, I know they have to be making billions to make it profitable to spend millions. And it evidently is true when you read the numbers that they take in on many times one drug, billions of dollars. Then you know that it's worthwhile. And if they want to pay $4.5 million for a half a minute on the Super Bowl, you know that they expect to get tremendous benefit back from that. So the advertising does pay off, and well, the question is, why and how does it work? And especially in light of if you really follow the ad in detail. Now, it's interesting to me because just here of late, I've caught some different drugs, newer ones that have come out on the market, and as I listen to the ad, for example, there's one on burning eyes and watery eyes and running nose. Okay, so hay fever or some type of irritation, allergy, whatever. And so they offer this drug, and they start talking about how one takes longer and the other one is fast, but you in no time, at any rate, when I say fast, within a couple hours you can be out, you can be walking amidst the pollens and the dust and whatever, and you don't react. And the people are thinking how great that is. Now, the interesting thing to me is that when you listen to the ad, especially one of them I recall, that says that taking this drug can lead to blood clots, stroke, cardiovascular problems, heart attack, and death. Now, You know, in my mind, I'm thinking, which would I rather have? Would I rather have a little bit of a drippy nose and burny eyes, or would I rather be totally paralyzed from a stroke, or partially paralyzed, or would I rather be dead? And when I think about that, I think, gee, I think if I have that choice on the table, I'll go with the drippy nose and the burny eyes, and maybe look for some safer method to take care of that problem if it's too bothersome to me, that I can't function well. There might be some other alternative. But nonetheless, people go out and say, hey, I want some of that stuff, because I want my nose to drip. And they, having heard, or supposedly heard, that it could actually, when they say those symptoms, that means that those are actually happened with people. It's not theoretical in nature. It means that in the process of testing the drug, those are the types of things that have happened. And the people who sign up to be guinea pigs for those limited human trials that they have before they go on the market, those people sign a waiver that if they die from it or they're permanently impaired, that they were fully informed, and therefore that they will hold harmless the pharmaceutical and or the people administering the study from any legal damage, i.e. money. So therefore, those are not hypotheses, those are basically things that have happened when they were testing the drug. Now remember, they were only testing it on a limited basis, because when a drug comes on the market, a new drug, it is, the final phase is it goes to limited trials. Could be anywhere from 10 or 20 people to 100 people, and they put that drug on the market and right away millions of people could be taking it. Now, all of a sudden, and again, I've emphasized this because I'm still not sure that people are catching it. You know, the limited human trials means that just a very small sampling of people have taken it. When it gets out on the market and it goes right away to thousands and millions of prescriptions, we're talking a whole new ballgame, and they know that. So what's happened is, that is referred to as the first several thousands or millions of people who take those drugs, if it's going to be a biggie, and a lot of people are going to be going for it, that's called the post-release trial. And that's when they really find out what this drug is going to do to people in mass, not just a handful of people, but people in mass. And many times it's pretty shocking. I've known of as many as 50,000 people dropping dead on a drug, and I've known the one after it's been on the market for a little period of time that as high as 150,000 people died on it. And finally the press and the lawsuits were so bad that it ended up that it was, I guess the FDA felt they had no choice but to temporarily pull it off the market, and who knows if and when it comes back. But I'm saying this to say that here the person is alerted. If you take this drug, this could happen. And it doesn't mean, as I say, it's a hypothesis. It means that in the limited trials they did, it already did happen. And so, yep, people will buy it. Now, how did they miss or ignore that information? Well, I think it has to do with a perception based on a perspective that they have about the pharmaceutical medical industry. It's kind of like they've been programmed, or either from their family or from the advertising or from whatever reason, and to develop a certain mindset. And so some of the other drugs I thought were interesting. One called, they would lower your blood sugar, and they said, now, gee, this is really nice because it can do it by injection, so you don't have to do it so frequently. However, you could have some severe immune failure or disturbance. Could have some very bad pain going through from your chest all the way into your back, severe pain. And you could have acute pancreatitis, or die. Now, see, again, that's not hypothetical. That drug actually has done that to people, but yet people will say, wow, that's great, I don't have to take a shot once a week, and I don't have to take all that stuff, all those pills. And so they'll go for it, and for some reason, it's not clicking. Gee, that could destroy my pancreas, because acute pancreatitis is a very serious illness, and I've known of people dying very rapidly with acute pancreatitis. And it's very painful to begin with. It feels like somebody put a spear through from your lower rib cage all the way through to your back. And interestingly, I've seen 2 cases where I didn't personally treat them, but another therapist called me to treat the one, and because they didn't want them to take the medical treatment, which is pretty much nothing almost. It's not that they wouldn't give you something, but it's effective-wise very poor. So this person called me and said, my husband was treating this friend of ours, and he's developed pancreatitis, and he's gone in the hospital. And actually they have him in a room with another guy with pancreatitis. And so they wondered if I had any recommendations. I gave them some recommendations on a Friday night, which is when this took place. The patient had high fever and severe pain, and was really a miserable person. And so they went and got part of what I said and took it to the hospital that night. By the next morning, the fever was down, but the person still was not feeling so good. They got the rest of the things, and by Sunday, all the symptoms were gone, and the person actually was feeling better, and he was told that if he continued that way, by Monday he would be released. On the other hand, on Sunday, the person who was treated by regular medicine died of pancreatitis. So I know how serious it can be and how miserable it can be. But people hearing this, nonetheless, will go out and buy or get prescription for, and of course they have to pay, or their insurance pays, somebody pays to get it, and that happens. I've watched on psoriasis both older medications and newer that are on the market, and new ones out there now, and they're saying, wow, within 3 months, up to 75% of your psoriasis can be suppressed. 3 months, 75% suppressed. Very expensive drug. And of course, they're saying, you know, if you have tuberculosis and you take this, it's going to knock out your immune system, so you could die of tuberculosis or destroy your lungs, as the case might be. It depresses your immune system. And of course you could develop cancer or die from it. But at least 75% of your psoriasis could be suppressed in 3 months. Not gone, not cured, but suppressed. And of course you'll pay a big bundle for this drug because it's one of the new ones out. And yet people are going to buy it. The older one that was out is still on the market, and it was an oral one. They gave it to a lot of people either with severe psoriasis or psoriatic arthritis, which is like a rheumatoid arthritis with psoriasis. And I personally know a young man who was in his 30s, mid-30s, who medicine had gone through their bag of treatments and nothing had worked. And he had a very bad case. Of course, part of the problem was he ate nothing but trash his whole life, including right up to the time that he expired. And nice person, but was kind of on the poor side and didn't, in any case, want to spend money himself on anything. So he was getting his medications paid for. And they put him on this last one of the drugs. When he took it, lo and behold, his skin improved and his joints became less painful, and so he was able to do a little more. But of course the warning is with it that it can destroy your heart, liver, or kidneys, or some combination thereof. And so at about age 36, he dropped dead of a heart attack from taking the drug. And the warnings on that were correct. They could damage all those areas and did. And there's a new one now I see has just come on the market for an RA, a rheumatoid arthritis drug. And there's a bunch of them out there. I won't take all the time talking about them, but there was one I was thinking about, though, that was on the market, was pulled off the market. It was strictly for arthritic pain. They were COX-2 inhibitors, and as far as I can find, as high as the numbers are up to as high as 150,000 people died before it got pulled from the market, and only because there was a lot of fuss made to the point that there were lawsuits and there was some press on it, so that it ended up finally being pulled from the market. But nonetheless, people are willing to go do that even with the warnings. And so then in my mind I'm thinking, why would that be? Because those same people, and I've heard this over and over and over, would get a suggestion from somebody, why don't you go for alternative treatment or to natural medicine or whatever? Oh, well, I don't know. I'd have to think about that. Why? I wonder if those herbs or nutrients or homeopathy, I wonder if that's really safe. I wouldn't want to take something that could be injurious. And I'm thinking, and I've heard this statement made, I'm thinking, they're willing to take the drugs with known effects. I mean, publicized by the companies that made it, and they showed up in trials. They knew it happened, but yet they just it didn't register, or they ignored it, or something happened. So, but they would buy it and take it, and didn't even maybe complain because it didn't feel so good, or it wasn't working very well, which really is true in a lot of cases. I've mentioned before that only about 40% of the people who purchase a prescription drug actually get the benefit for which they bought it for. The other 60%, which means 6 out of every 10 people buy a very expensive drug, and they don't even get not only the effects they were trying to get, but they could be damaged or killed in the process. But they're willing to accept that. And I kept thinking, what is going on? Why would somebody who, number one, the drug is dangerous, number two, it's not working for what they bought it for, would they be, or they're feeling really lousy because it is producing a lot of those symptoms, why would they be so reluctant to test something that's been around, like herbs? Nutrition's been around forever, and nutrients have been around forever, almost. Herbs go back thousands of years. Homeopathy goes back for over 200 years and is so dilute that even medicine said, I couldn't possibly work because it's so weak it couldn't do anything. And yet they would be reluctant to take it because they wonder if it's safe. Has it been proven? Well, gee, when they find out how poor the studies are for regular drugs before they get on the market, if only 4 out of 10 people get the effect, how proven is that? That's not even 50-50. You only get a 50-50 shot at it. It's only 60-40, not in your favor. I would say there could be a few drugs that could be an exception to that. They could be so potent that they'll override everything. Like if you took too much digitalis, it's going to pump up your heart for a while before you die from poisoning from it if you get very much of it. So yeah, some of those could be that way, but on the average, about 40% do what they sell it for. And the testing sometimes has been very poor on these drugs because a few years ago there was a lab that found out that before a drug goes on the market, they do something called an LD50 study, which means 50% of the animals that they give doses to die at that concentration, which means so many milligrams per kilogram body weight. So the FDA supposedly requires that you have to have those LD50 studies so that you get an idea how to dose the drug. Well, a lot of drugs went out on the market because in many cases the pharmaceutical doesn't bother doing that test themselves. They hire it out to some lab who specializes on doing LD50 studies. So it was discovered that this lab who was doing all these studies for a large number of pharmaceuticals, somebody went to visit the lab and it was locked up, abandoned, full of cages of dead, rotting animals, everything covered with dust. There were no tests being done, but somebody was filling out reports saying LD50 of this drug is such and such, and submitting it to the pharmaceutical, getting paid for it, and the pharmaceutical submitted that along with the rest of their material and got the drug approved on the basis of the LD50 study, which never happened. And you know what happened when the FDA finally found out that all these drugs that they were supposed to have done LD50 studies on, it was never done? They did nothing. They left the drugs on the market and kept it quiet like nothing ever happened. So, yeah, the people would go to those and feel safe taking those, even though they say it could kill you, but they're afraid of an herb that's been around 200 years and effective. Well, they couldn't be any worse than the 40% that the pharmaceuticals are getting. And the funny thing is, there are studies, but all along the pharmaceuticals have been saying they weren't. And then, of course, is it expensive? Well, I don't know very many herbs and or homeopathics that come anything close to $20 a pill for many of the prescriptions, or to $2,000 to $3,000 a dose for pharmaceutical chemotherapy and so forth. I don't think any of the natural homeopathic products come close to that. Now, the question is, what leads us to do that? And what it is, it has to do, in my mind, with perception and also perspective. The perspective you have. Now, as some of you know, if you've been listening to my broadcasts, that I've been involved with natural health field for pushing 40 years. And back in the early days, I had a tremendous amount of studies and training and about every kind of psychotherapy there is. I did a 2-year program at Cleveland Psychiatric Institute, which was connected with Case Western University School of Medicine, Department of Psychiatry. And we covered all kinds of approaches to counseling, crisis intervention, psychotherapy, and I did this work with patients in Cleveland Psychiatric Institute, as well as participated in, for 2 years, group therapy as a participant, as part of the learning process to do group therapy. I have been trained in and was certified in hypnotherapy, psychotherapy, transactional analysis, etc., etc. And I've studied pretty much every system that's out there, including NLP, which I think is a very good system. And so I have some background in understanding the psyche and how it works. And so it's interesting because, first of all, we'll talk just for a minute or two about definitions. Perception is defined. Now, this is from the freedictionary.com, and they quote from 2 different standard dictionaries. One, the American Heritage Dictionary, and the second is Collins English Dictionary, complete and unabridged. And anyhow, they're very, very exhaustive. And so under perception, we have on the American Heritage, definition number 1, the process, act, or faculty of perceiving, and number 2, the effect of perceiving. Now, then they say under psychology, A, recognition and interpretation of sensory stimuli based chiefly on memory, and the neurological processes by which such recognition and interpretation are effected. Then they go on to say insight, intuition, or knowledge gained by perceiving, and the capacity for such insight. Then from Collins, you get the act or the effect of perceiving, insight or intuition gained by perceiving, the ability or capacity to perceive, ways of perceiving, awareness or consciousness, such as advertising affects the customer's perception of a product. And then they go into zoology and law. Okay, so that gives you an idea about perceptions. Perception really gets down to what comes into your brain mind via your senses, whether it's touching, smelling, tasting, hearing, or seeing. The sum total of all that coming in is your perception. Now, that's the raw data. But what your mind-brain does with that is what ends up being your perception. It's not just that you're perceiving, but putting it together, and what ends up registering with you is the actual perception. And so I'm saying that to say, I guess when people watch some of these ads, they don't perceive some parts of it for whatever reason. Okay, now whatever reason in my mind has to do with our our background, our perspective. Now, the perspective that we have, and I'll give you a definition of perspective, a view or a vista. In other words, it's like a picture or a view or a vista of something. Again, from the same dictionaries, a mental view or outlook. It is useful occasionally to, and here's an example, useful occasionally to look at the past to gain a perspective on the present. The appearance of objects in depth as perceived by normal binocular vision. So, like a perspective drawing in architecture, or the perspective of seeing how things fit together. So then also, the second dictionary says, a way of regarding situations or facts and judging their relative importance. The proper or accurate point of view of the ability to see it objectively, to try to get some perspective on your troubles. And then they get into the architecture type of thing also. So those are kind of the definitions of perspective and perception. So perception has to do with the taking in of information, and perspective has to do with conclusions arrived at. Now, the question is, however, those conclusions we arrive at, are they objective in nature, or are they somehow tainted? And that's, my whole purpose behind this is that, in fact, it appears that, first of all, things are not always the way we think they are, and they can be very tainted. Now, we've talked before, of course, about the rose-colored glasses, that if you were to wake up in the morning and somebody had put on rose-colored glasses and you looked through them, you would swear that the world had a rose-colored tint to it. And if you weren't aware that you had the glasses on, everything you see would be tainted by the rose filter. Or if you put purple glasses on, then same thing, the world would have a purple appearance. Everything would. Now, if you weren't aware you were wearing those glasses, or somebody did it with contacts, you might think, wow, I didn't remember that everything was quite this rosy or quite this purplish, but then maybe I just wasn't paying attention. And so then everything that came through would be tainted. And we do the same thing to our perception based on our upbringing, our early life activities and exposures and programming and so forth, until we have, at some point, by our early perceptions that came to us as a very small child, when our mental filtering capabilities in terms of logic weren't working well, we were programmed, in a sense, to have a certain perspective of the world, and that perspective is going to taint our perceptions, how we take in this information. Now, I've mentioned before, we have mind filters that delete, distort, and generalize all the sensory information coming in. Based on memories that have been programmed in, they have an effect on what we see or don't see. And of course, we can't always be sure that we're not being deceived. For example, if you were to look at this paper I'm holding up, the first impression almost always is to see a triangle, but there's no triangle there. It's actually 3 circles with a pie cut out of each of them, arranged in a triangular arrangement so that those pie sections are facing into the center, which gives us the illusion when we look at it of a triangle. And if we were just to glance, we might say, yeah, I saw a triangle, but there wasn't a triangle there. Now, does that make you deceptive, or does it make you deceitful? No, that has to do with perception. Remember that the brain, I've talked about it before, and the whole idea of gestalt is that the brain doesn't like to be unsettled, so when it sees a group of things, it tries to make some order out of them and make them look like something that is more familiar, because we don't like unfamiliarity. And so it affects our perception. Now, one of the types of therapies that I mentioned earlier was NLP. And NLP is very good at recognizing what they call presumptions that we have, which are based on prejudices which were programmed in at a very early age, so that we only see the world through a certain set of lens, and our senses are disturbed. Now, I was going to read you just a little bit of information on some background on NLP, and they're big on saying the map is not the territory. Now, the map is not the territory is an idea that was talked about several years before NLP, and we're not going to go into it in depth, but they picked up on this. They weren't the original people who did it, and in fact, I have a paper that mentions the originator of it. We'll find it, maybe we won't. Here, I've got a lot of papers to look at. But anyhow, they said the map's not the territory, and what they're saying is that we make a map in our mind of the world, of the way the world is. Now, it may or may not be very accurate. You know, if somebody were to draw you a map to go someplace, and they kind of, from their memory, drew in the way they thought it was, and you took the map and started to find the place, you may have trouble because their memory may not have remembered it that accurately. And so it was a map, but it wasn't an accurate map. And so we do that all the time. We use a map of something, or we create a map in our mind if somebody gives us verbal directions, and then we're trying to follow that map that we've created based on what they told us. And if they were inaccurate, if they said you're going to go 4 streets down and you're going to turn right, and at the traffic light on that 4th street, maybe the person who is remembering there was a street that didn't have a light, and then there were 4 streets in a row that did have a light. And so you get there, and he says, well, it's the fourth intersection, the 4th street, at that light, but the 1st street you see doesn't have a light, but you count that, so you got 1, 2, 3. You're turning on the 3rd street, and you don't get where you're going because both of you were correct in a way. But the first person in their mind was thinking, well, because he had only seen 4 lights over 4 streets. So it would depend on how he gave us the information. If he said it was the 4th light, then you would be okay. But if he said it was the 4th street, turn at that light, then you could be misdirected. So the map is not the territory. The map is what you've created, and you somehow try to make the world fit the map that you have created. And now NLP calls those presuppositions, and they're big on saying it's not the territory. And the writer says that this is not a, it is one of the highly important NLZ presuppositions that the map is not the territory, and we are likely to achieve a rapport quickly when meeting someone for the first time if we recognize this important truth and work with it. It's very easy to believe the other person is being awkward, naive, or just stupid when the only difference between us is our internal map. In other words, the perception of the world each of us has is entirely different. Now, the person who wrote this says, different perceptions. Anyone who has had many years' experience of the judicial system as I have will know only too well how several people will witness exactly the same incident, yet have entirely different versions of what happened. yet are all endeavoring to recount truthfully what happened. When I prosecuted a criminal case, I almost dreaded having too many people who claimed to be eyewitnesses to an assault. Not only do they all see things from different angles at slightly different times, but they all bring their background and experiences to bear and filter what they see against their internal map. Okay, so that's true, and it was interesting because I had run across a cartoon, and it's called, in Pottstown, it's Perception versus Reality. Now, I don't know if you can see it, and it's okay if you can't, but on this side, you have this person looking at three different situations. You have a man standing on the side of the street in wrinkled, probably soiled clothes and a hat with a jacket all zipped up. And then you have three youths kind of clustered together pointing around. And then you have another person over by a car looking like they're trying to get in the car. So if you look at the top, or if you can see it, if you can, I'll tell you, he says about the guy standing there, a drug dealer, and the three in the group, gang members, and the person by the car, a car thief. That's his perception. The reality is the guy standing at the curb is waiting for a bus to go to work, so he's dressed in his work clothes. The three guys who look like gang members are a neighborhood cleanup group that are out looking at these things on the ground that need to be cleaned up. And the guy looking like he's trying to get in the car is trying to unlock his car to go pick his kids up at school. So it's reality versus perception. Now, the perception creates the reality that we have of the world, but it may not be the same as what's out there. And that's kind of interesting. And I ran across some very, very different sayings coming from different sources that are, to me, kind of humorous, but at the same time very to the point. For example, we don't see things as they are, we see them as we are. A Nice Nin was the author of that. Another one by John Moore. Your opinion is your opinion, your perception is your perception. Do not confuse them with facts or truths. Reality is purely a perception of the individual mind. It follows that since no two minds are alike, no two perceptions of reality are alike. It further follows that what really is to one may seem complete madness to someone else. Yefim Novikov. And here's a real simple one called, most people see what they want to, or at least what they expect to. And then I saw one I thought was really cute. It says, when everyone is thinking alike, then somebody isn't thinking. And the other one I thought was really cute. This is a quote from T.S. Eliot. It says, humankind cannot stand very much reality. If reality is perception, how do you feel the world perceives you? And one of my favorite is, there's a artist by the name of Escher, who does some very unusual drawings, and this was always one of my favorite. And I don't know if you see it or not, it's two hands coming out of a piece of paper, and each hand has a pencil in it, and each hand is drawing the other. And the question is, how real is real? Because actually this is on the front of a book. They use this illustration called How Real is Real. And so sometimes what we think we see and perceive is not exactly what's there. In fact, even Albert Einstein said reality is merely an illusion, albeit a very sophisticated or persistent one. So I'm saying all that to say that things are not as solid or as absolute, and because of that, we are kind of tainted in the way we perceive the world. Now, I see we're running out of time. Looks like this will be a two broadcast sessions, because I have some interesting things that can be helpful in cleaning up some of this that I want you to look at and think about. And one is, before we leave, I'm going to make mention about perspectives in relation to psychology. everybody thinks, you hear people say, well, psychologists have found this or shown that or proved this or whatever. And of course, psychology is really not even a soft science, let alone a hard science. There's still a lot of holes in that cheese. This is a article called Psychology Perspectives. There are various different approaches in contemporary psychology. An approach is a perspective, i.e. a view, that involves certain assumptions or beliefs about human behavior, the way they function, which aspects of them are worthy of study, and what research methods are appropriate for understanding this study. These may be several different theories. There may be several different theories within an approach, but they all share these common assumptions. You may wonder why there are so many different psychology perspectives and whether one approach is correct and others wrong. Most psychologists would agree that no one perspective is correct. Although in the past, in the early days of psychology, the behaviorists would have said their perspective was the only true scientific one. Every perspective has its strengths and its weaknesses and brings something different to our understanding of human behavior. For this reason, it is important that psychology does have different perspectives to the understanding and study of human and animal behavior. And so in this particular article, they give a summary of at least 5 different psychological approaches, sometimes called perspectives in psychology. So we're getting back to perception and perspectives. And as I say, all of this kind of was awakened in me and reminded me of my studies, because when I studied at Cleveland Psychiatric Institute at one time, well, along the way we had to study a lot of different approaches and ideas. And so on one occasion they showed us this movie, back then because they didn't have the videos. The movie was called The Eye of the Beholder. And the movie starts out by a person hearing a noise and opening a door and walking into an apartment and seeing a scene. There's a lady laying on the floor. There's a lot of red around. And there's a guy standing there with what appears to be a knife in his hand. And the lady who opens the door goes running and calls the police, which starts an investigation. The interesting thing is that different people related to people involved are interviewed and give viewpoints about people that are so interesting, including the description of a murder scene by the person who called the police. And when you get down to the core of it, you find that the whole thing was totally different, and the people totally different, than what all these eyewitnesses to either the people or the so-called event saw. And so it was an eye-opener to see how people, in all honesty and all truth, put them on a lie detector, they would be telling the truth, believe that they saw something about these different people or the situation that wasn't quite the way it was when they finally show what really happened and what the situation really was. So we've run out of time, so we're going to pick up on it next time and get into the perspective and perception a bit more, and then talk a little bit about some things that can kind of break some of these patterns and maybe get rid of some of the mind filters that can give you a better view of the world. It was nice being with you again. Don't forget to go to our Mind Your Health Cast website.com, and we're open for comments, whether on the YouTube or on the website. And we welcome any comments, criticisms, questions, and if we have an answer, we'll give you an answer. If we don't, we'll give you our best opinion. It was nice talking to you again. Until next time, be healthy.